I'm Dr. Norma Nairn, and I'm a GP and Medical Director of Te Hiku Hauora, which is a Māori health provider in Kaitaia in the far north. Well, Orion Health engaged with us a couple years ago, looking for ways to improve the equity of healthcare, especially in the far north. We have 12,500 patients in our organization, and 55% of our patients are Māori. All of us up there live in about the 4th or 5th quintile. So there's a lot of socio-economic burden and a lot of health burden up there. So Orion came to us and said that they'd like to partner with us and find a way to improve patients' health. We all identified that it's that lack of digital access that creates such inequity. So Orion Health said, let us help you. And we could get you, some blood pressure cuffs and oxygen for your patients. We could make sure your patients not only have these devices that'll help them monitor their conditions at home and help them with their self-care, but we recognize that your patients also don't necessarily have access to data, or maybe can't even get to the internet unless they leave the hills that they live in and come to the road and finally can get access, and then have to pay for the data and maybe don't have the budget for that. So let us help you with that. So you pick a group of high-risk patients and we will help pay for their data, get them the device they need, and get them the devices they need to do the self-management, whatever they need and whatever you need to help the patient engage digitally. And as we started looking at products that were available, we were looking at the product that they were using in Canada, we started saying, this doesn't fit our population. We need a platform, because the Canadian platform wasn't going to work. So we needed a platform that Orion's team could take and adjust and change and make it so that it fit our people here in the far north, and not urban, rural, remote, Māori. So then they engaged two others. They engaged the Auckland University, their research arm, and they engaged the precision-driven health for their innovation arm. And they actually pulled together this amazing partnership of people and organizations that have the experience in the research and innovation, and also had money that they could put into it. So now we had Orion and Precision-Driven Health and Auckland University, and everybody came together, and all of it with us in the center, where we can make a difference with patients. So now we're creating a whole different platform, and we're working on different messages that are key to our people up in the far north, images that are key to our people in the far north, and an approach that we're going to implement clinically with a full support team. It's been amazing.